Okay, well, thank you very much, and we appreciate the opportunity to visit Atlanta and tell you about NeuroMetrix. We are traded on NASDAQ under the ticker NURO, and looking forward to giving you an update on the company. So I'll just pause for a moment on the safe harbor disclaimer, and now that you're done reading it, I'll continue. Okay, so NeuroMetrix is a company that's been in business since 1996. The company came out of Harvard Medical School and MIT. We're based in Boston, just outside of Boston, and we actually manufacture outside of Boston as well. So this is all US-made product. We have really, for most of our life as a company, both private and public, have been what I would call a medical device company, developing devices that physicians use to diagnose various kinds of neurological disorders. And we actually still have elements of that business, what we call neurodiagnostics. That's not the story I'll be telling you about today. That is a story that it's interesting, and those products generate cash for the company. But the growth opportunity is an emerging business for us, which has a technology link to that neurodiagnostic business, but is a different direction. It's a consumer health business around chronic pain. So we have launched a device called Quell. This is a wearable neurostimulator available over the counter now to treat chronic pain. And that's the story I'll be telling you about. However, if you look at the financials, and we'll come back to this at the end, you'll see elements of the neurodiagnostic business. I just wanted you to be aware of it. So Quell is an FDA-cleared product. It's on the market. Our most recently reported quarter, which we just reported this past Thursday for the first quarter, was the fourth quarter of sales of Quell. So we have some history I'll be telling you about. And it's an attractive business model. There's a device, and then there's a consumable that goes along with the device. So you have revenue both from the initial device as well as annuity from the consumable. And this is a really important year for us for Quell. So we launched last year. And this is a significant growth year for us. And as Tom mentioned in the little 3-minute intro, we're starting to move into retail, which is a critical channel for us in getting this product to the widest number of consumers. Okay, so let me just tell you a little bit about chronic pain, and I'm sure everyone has some intuitive sense of what chronic pain is, and hopefully you yourself don't have it, but I'm sure you know people with chronic pain. Technically, clinically, what it means is pain for 3 months or longer most days. This is not protective pain. This is not good pain. This is maladaptive pain. So this is not post-surgical pain. This is not, I played too much basketball on the weekend, my shoulder hurts. This is osteoarthritis, low back pain, fibromyalgia, diabetic nerve pain, those types of conditions. About 100 million people in the US have chronic pain. At least half are not adequately controlled. And the issue with chronic pain, it goes well beyond the pain itself. It's to how it disturbs people's lives. They don't sleep. They are not active. They tend to be depressed and anxious and generally have poor health. And all those things conspire in a vicious cycle to make the pain worse. And then you're in this very, very bad cycle. Now, as you know, pain is generally treated with pharmacologics. Over the counter, your Tylenols, your Advils, but in more serious chronic pain, you're dealing with prescription pain medications or narcotics, and I'm sure you've heard about the really epidemic of prescription painkiller addiction. In fact, recently the CDC, literally in the last couple months, came out with a position statement that prescription painkillers should not be used for chronic pain outside of cancer pain, which is a fine thing to say, except what are you going to do for patients? What are you going to do for people who are in chronic pain? The U.S. is spending $600 billion, direct and indirect, to manage chronic pain. That's more than cancer, diabetes, or heart disease. And U.S. consumers are spending $20 billion out of pocket, really in kind of a desperate attempt to get away from medications. So these are sort of called complementary therapies, acupuncture and chiropractic care, nutraceuticals, herbals, and such. So a lot is being spent, a lot of interest in getting away from a focus on pharmacologic approaches. So into that significant market, significant unmet need, we've launched Quell, and what I'm going to show you is a video that will introduce you to Quell. Now, this is actually a TV ad that's presently running. You potentially have seen it. It's running on a variety of different cable networks. So it really has two purposes. One is to introduce you to the product, but also to show you how we're marketing it via TV, which is one of the key channels in building brand awareness. So if you could run the video, please.
A medical breakthrough is opening up the doors to a whole new life. For those who suffer with chronic pain, introducing Quell, advanced wearable pain relief that allows you to regain what chronic pain has taken from you. Quell is 100% drug-free and FDA cleared. Quell uses neurotechnology to bring widespread chronic pain relief 24 hours a day, even while you sleep.
Quell is a total paradigm shift in chronic pain relief. Quell stimulates sensory nerves in your upper calf. Neural pulses are carried to your brain, triggering the release of natural pain blockers that block pain signals in your body. In a clinical trial, an incredible 81% of Quell users reported improvement in chronic pain.
It's slim, lightweight, and discreet. You can wear it under your clothes.
I feel like I have my life back after using the Quell unit.
Call or click now to begin your risk-free 60-day trial. Act now and even your shipping is free. If you're not satisfied for any reason, simply return it. Call or click to receive your risk-free 60-day trial. It's time for a new beginning with Quell.
Okay, I'll get back to the commercialization in a moment after I tell you a little bit more about the technology, but that's the TV advertising is a key component. So just to reinforce a couple points, so Quell is a medical device, Class 2 medical device, FDA regulated. In fact, it was a prescription device that we took through the FDA and brought it over the counter. It's used to treat chronic pain. It has a very strong label from the FDA, so we can market it for treatment of chronic pain 24 hours a day. Very, very unique FDA label. We talked a little bit about the types of chronic pain. So it's used for back pain and osteoarthritis and diabetic pain, fibromyalgia. Those are some of the common applications. It's a high-powered nerve stimulator. So what it does is, as you saw in the video, it stimulates the nerves in your upper calf, and it's always placed on the upper calf, regardless of the location of the pain. And that basically evokes a response in your pain centers in the lower levels of your brain, which triggers them to overproduce your endogenous pain modulators, what are called enkephalins. I'm sure you've heard of endorphins. The enkephalins are similar in a sense. They're your own pain modulating chemicals. So essentially, you're upregulating your own ability to decrease pain perception. It's inherently safe with really no side effects because you're leveraging the nervous system to do this. And it's very important. Even though you're placing it on the leg, you're getting widespread pain. So that's sort of a counterintuitive notion. You sort of think about putting one of these devices directly on a site of pain. That's not the case. You always put it on either calf, upper calf. And importantly, it's a connected health device. So it does not require a smartphone, but that enhances the user experience, allows you to control the device discreetly without actually having to physically engage the device. And the device also records many parameters of how you're using it, your sleep quality, your activity levels, and all that's reported back via the app, allowing you to optimize your therapy. Now, this technology, as I said, is FDA cleared. It's been looked at in clinical studies, and we have other clinical studies ongoing. This is a figure from a manuscript that actually is presently in review. This study was done last year. And what this shows, without getting into too many of the details, is that about 8 out of 10 people, 81% of Quell users over a 60-day period reported improvement in their pain. That measurement is called PGIC, or Patient Global Impression of Change, and basically asks people after a certain period of time, did your pain improve or not? And that is one of the standard ways in clinical trials of pain to evaluate pain perception or pain improvement, because the way a pain therapy helps somebody varies from person to person. For one person, maybe it reduces your pain from 8 out of 10 to 4 out of 10. For another person, you're sleeping better. For another person, they become more active. So this is a global assessment of pain therapy. This is a very powerful result. This is comparable to what you get with pain medications. In fact, it's better than some pain medications, and really there's no side effects. Okay, now to move on to the commercialization, the device itself comes in a starter kit, which is $249. We view this as wearable technology, so if in the class of your fitness monitors like your Fitbit and smartwatches like your Apple Watch. And that includes the device itself, the band that you saw, and one package of electrodes, which is 2 electrodes, which is ostensibly a month to 2 month supply. So each electrode gives you 2 to 4 weeks. We prefer that it's 2 weeks, but people try to stretch it up to 4 weeks. So that gets you started. We give purchasers a 60-day money-back guarantee. That's very, very important. If you go back to the clinical data, 8 out of 10 people improve, but 2 out of 10 don't, which is characteristic of pain therapy in general. Not everybody's going to improve. You have to give people an opportunity to try it and see if it works for them. So that's where the 60-day comes in. And in fact, as you'll see, our returns line perfectly to our clinical data. And then the reorders are $30 for 2 electrodes, so $30 for 1 to 2 months of the consumables. Now, I said before, 100 million people have chronic pain. Obviously, not everybody is going to be suited to this device in terms of their pain type, as well as their ability to afford this type of technology. So we've done extensive research on this, and we believe there's about 20 million U.S. adults that are ideal targets for the technology. These are typically people that are in their 40s and 50s and above, well-educated, $75,000 or more household income, and are sort of characterized by looking to manage their pain with non-pharmacologic or less pharmacologic approaches so they can be more active, more effective, and generally more satisfied with their lives. And that's the target market. We have it characterized in 3 different groups and have identified ways to get to those 3 different groups. How are we getting to people? When we launched in June of last year, we were primarily online, quellrelief.com. That's our website. That's an educational website with an e-commerce behind it. We subsequently, last year, expanded to Amazon, as well as QVC. QVC has been very successful for us, typically runs every few weeks, and they've been quite satisfied with it. It's a great demographic for us. Tends to run older, tends to run relatively high incomes. But the really significant step up for us, and what is really sort of the catalyst, if you will, for 2016 is to expand into retail. And by this I mean mass merchandisers and chain drugstores. Because ultimately this is a medical product, even though it's sold over the counter, and consumers expect to get it or at least see it in traditional places where they get their medical products. So they expect to see it at a Walgreens, a CVS, a Target, and so forth. You can't just walk into those retailers and say, hey, put this $250 device on your shelf and let's hope for the best. You have to convince them that this is viable technology and is going to be successful from a consumer perspective. So we just announced last month that Target is putting the device into over 500 stores. They have what's called a Connected Health Initiative. So this is a section of the store near the pharmacy. All Targets have pharmacies, where they're promoting a group of what they call connected health devices. So these are smartphone-enabled medical devices, blood pressure monitors, heart rate monitors, our device, and several others. So it's kind of a category that they're building on. So they're going to start with 500 stores, and that they started putting it on shelf in the last couple of weeks, and probably by the end of this month, it'll be in all 500 stores. So we're very excited by that as our first foray onto retail. But we want to move beyond that. So we're in discussions with other retailers and hope through the balance of this year to get into additional retail settings, including chain drugstores. And obviously the 2 prominent ones are Walgreens and CVS, and hope to see that occur during the balance of the year, at least to begin. Okay, so this is the 4 quarters of sales. It's a bit of a busy graph, so let me just kind of walk you through it. The large graph to your left is the device sales. The blue bars are the shipments, and the green are the net devices. So as I said, there are returns. We want returns because it means that we are getting to the widest section of the market. If we don't see that 20% returns, that's not consistent with our clinical data. So that's pretty much exactly what we're seeing. So in 4 quarters, really primarily online and QVC, we've shipped about 22,000 devices, and we hope to see this obviously continue and grow as we move into retail. In the upper right-hand corner is the electrode reorders. So these are customers repurchasing electrodes on an ongoing basis, and we're seeing strong growth in that as well. It's still too early to tell exactly what the annuity stream is going to be per customer, as we're learning how different users adopt the technology. Some people use it every day. Some people use it episodically. Really, it's consistent with their pain. And then in the bottom right-hand corner are the invoice sales, which is basically the blue bars times ASP and then the green is GAAP revenue, which is of course what we report. Now there's a difference here between invoice sales and GAAP revenue because revenue recognition, reserves, and it's a fairly complicated process. As you get into retail, for example, you can't just recognize the revenue. You have to wait until the product sells through. It's a new channel. We can't predict returns. So just to let you know, as you look at the company, that GAAP revenue is going to be choppy and jump up and down until this all sort of kind of runs through. But we think the invoice sales as well as the individual levels of electrode reorders and devices is really what's indicative of the market growth. And over time, they'll all line up, but it's going to be a little bit choppy here for the next, at least the next 4 or 5 quarters. We have a very strong competitive position. Chronic pain is not managed with a single magic bullet. The key is to get individuals to a level of pain that's manageable for them and they can function effectively, which is different for every person. But in terms of the profile that we have, our benefits shown on the left in terms of ability to treat chronic pain with a single site stimulation, we can treat multi-site pain, no side effects, and the so-called digital health or connected health aspects. There really is nothing that lines up to this, and so we think we've got a great position in having a role in the toolbox for people with chronic pain. And some people, that's going to be their primary source of pain management, and others, it's going to be an adjunct to medications. We have a strong product roadmap and innovation strategy. This is all proprietary technology. We have, the company has over 40 patents, one issued specifically for this technology, 7 or 8 in process, and many others that are being planned. So strong proprietary position. But really, ultimately, in a space like this, in consumer health, you have to innovate aggressively. And generally, the cycle is the Consumer Electronics Show in Las Vegas in January. You really have to innovate and release products on that cycle because that's what the expectation is of the market. And we have a long legacy as an innovator and are quite comfortable with our ability to do this. There really isn't any company or even academic laboratory that's stronger at neurostimulation than we are. And beyond chronic pain, we're also looking at some expanded clinical indications in adjacent applications, such as restless leg syndrome and other sleep disorders, which tend to cohabitate with chronic pain. Growth strategy is very straightforward. I've hit on all the elements. Expand into retail. We're looking at some strategic partnerships that can help us accelerate brand building. We're not interested in licensing the technology. We want to build the brand. The company owns the brand, and we think that's going to provide the greatest return for investors. Product innovation, we talked about expanded clinical indications. International is not a focus for us right now. We will look at that probably next year, but right now we're entirely focused on the North American market. Briefly on the financials, top line revenue has grown from about a little over 5 to over 7 in the last couple of years. That growth is almost entirely in Quell. There's additional 2 lines there, DPN Check. That's a diagnostic product. That's the neurodiagnostic business I mentioned before. We have one element of that business is growing, and then we have a legacy business, older diagnostic products that we simply manage for cash, and that's decreasing because we're not promoting that product anymore, but we continue to ship consumables and it generates cash and will for the next several years. Margin is dropping somewhat. That's as we build the Quell business. We're initially selling lower margin Quell devices, and then as that base grows, the consumables will increase and the margin will go up. The consumables have a very high margin. The device, not so much, particularly when it goes through distribution. So we'll see a bit of a dipping there and then a return as the business becomes dominated by the consumables. And cash usage has gone up, primarily related to marketing of Quell. And then just to wrap up, we have about a little bit on the capital structure, almost 10 seconds. We have about 25 million total shares on a fully diluted basis. That really is about 10 million in common or common equivalents and 15 million in warrants. Of that 15 million in warrants, about 11 million is in a recently issued financing. That's about $2.30. And a particularly important part of that is one half of that is a one-year warrant that will expire in December. So right now the stock is trading around 180. If it gets up to 230 or north of that, we might see those warrants. Some of those warrants could exercise, and that would be a financing mechanism. So with that, I'll stop. Do we have time for questions? Okay. All right. Well, we have a couple minutes. If any, are there any questions?
Are you working with doctors at all?
We do. We are marketing the product through doctors as well. It's not a primary channel, but it's important to get healthcare professional buy-in. So yeah, we do that more from a strategic perspective than in terms of driving significant amount of volume.
Any way for insurance, Medicare, Medicaid to cover this?
No, and we're not really interested in insurance. We actually have our prescription device is reimbursed. It's a predecessor to this, is reimbursed by Medicare and most commercial insurers. But for a variety of reasons, that's probably too complicated to go in right now. It's really that whole home medical equipment or durable medical equipment space is a dying area, and so we're not looking to get insurance coverage for this product. I don't think that's a very effective strategy at this point. Now that may change in 3 to 4 years, but right now it's purely a cash product. Thank you very much.